so the kidney, it has the capsule. Around the capsule, we have the perirenal fat, and above this perirenal fat, we have the renal fascia, which covers it. And above this, we have a membrane, which I don't remember.
This fascia renal is continue of the fascia transversal.
Yes, and posterior to the kidney, we have the perirenal fat, which holds the kidney in its position.
Yes. And who's ready to ask some question? Who wants? You. Are you ready? This perirenal fat, okay, are you able to find the perirenal fat inside of the umbilicus?
Yes.
Between the structure?
Yes. And I would also like to add, we have pararenal and posterior.
Yes, and it is posterior. Okay. Thank you. And about this picture, who is ready? Only these two? You. Part for you. Your part was for you. You.
No.
No.
Only Jack.
This picture shows the renal to the kidney. So we can.
Which section it is?
It is in front of kidney.
Frontal.
Frontal surface, yes. So we can find the medulla and cortex. This is cortex, and next it, yeah, this is medulla. We have the renal pelvic, and we can see the pararenal fat.
It is perirenal fat.
Yeah, perirenal fat. And
What is the name of this apex?
I forget.
Perfect. Who is ready? You. Do you know the name of this part? Renal papilla, yes. And what about this? No, it is not pyramid.
Isn't this the whole part of the cortex, which is divides between the different pyramids?
Some part of the cortex is here, but between the pyramidal renal pyramid, you can find the extension of this cortex that we call the crux of the ren, or renal crux. Okay? This is the extension of the cortex between the renal pyramid. And what's the name of this duct? What's the name of this duct? You, Pinky. What's the name of this duct? The renal papilla open into calis minor, and some kind of drain to the calis majora, and some calis majora drain into the apex. Okay? Now, what about this picture?
Is extrarenal tubule. It's contained like in cortex. It's one capsule.
And the glomerule?
Yeah. This is it's one capsule, and this is the capillary
this blue one. This blue one.
Blue one. Yeah, it's then
You
below.
can read. What's the name of this?
This is renal proximal tubule. Then we have lobe of Henle. Then distal tubule. Yeah. The blue one is in cortex. Then the tubules are in the medulla.
Yes. If we imagine here is the cortex, and this part is the medulla, we can find the capsule and the proximal and distal convoluted tubule, more of them inside of the cortex. And in the medulla, we can find the tubule. For example, the Henle tubule artery
This is the
segmentation.
segment.
Oh, okay. Oh, yeah, sorry.
Okay. Who is ready? Salim, no? You.
Can we have suprarenal gland?
Superior?
Suprarenal gland. Yeah.
Suprarenal, polar or A and infra. What you explain?
Yeah, because
I told you this picture. Yes, this position.
they're showing you the arteries within the kidney. The kidney is divided into capsules, and there are the renal artery divides into 5 branches, which supply different areas. So this is the superior lobe, the top. This one is the inferior lobe. These anterior, inferior, and anterior, superior, and the pink one is posterior.
If you remember, I told you from the abdominal outcome we have one normally. We have one branch, one artery for each kidney. Each of them are going to go inside of the both kidney, and to be able to remember, I show you this position. I told you imagine this position and never forget. I have 5 fingers. These 5 fingers are going to remember you 5 segmentation of the artery inside of each kidney. 4 of them, the position is anterior, and 1 of them, the position is posterior. Now here, each renal artery are going toward to the umbilicus of the kidney, go inside of the kidney, and in each kidney, we can remember 5 segmentation. 4 segments are visible anteriorly, and if we rotate and look at the posterior view of the kidney in this position, in this slide, I am able to show you the 5th segmentation of the red. And here also with 5 different colors, we are going to remember you that each kidney contains 5 segmentation for the artery. And none of these arteries are going to anastomose each other because they are together not, they are an artery. And here again, it is going to remember you that this branch is going to supply the superior cord, this branch is going to supply the inferior cord, this branch and these are going to go anterior superior and go inferior, and this is the posterior branch. Now about this picture, according to this picture, you can remember and get in your mind that which of the renal artery and which of the renal vein are longer. Which of them is longer?
The right renal artery, yeah, the right renal artery is longer, but the left renal vein is longer.
Because the right vein is near the vena cava inferior and the left vein is near the abdominal artery. And here, if you notice, you can find that the left renal vein and the right renal vein, both of them are the anterior structure inside of the umbilicus. So never forget the anterior element inside of the get that?
Yeah.
So please look at the picture most of the time, and if you get this picture or the same picture in your mind, according to this picture, you are able to answer so many of the questions in the exam. And here you are going to look at the posterior structure or retroperitoneal structure. If you remove the parietal peritoneum, you will be able to find this picture. Both kidney, both suprarenal gland, the vena cava inferior, the abdominal aorta, these muscles, the ureter, left and right ureter, they are going to be found and they are passing immediately posterior to the parietal peritoneal sheet. We remove the peritoneum to be able to show you this structure. So in your exam, it is possible I ask you all of the following structure, the position is retroperitoneal except right kidney,
Yes.
left kidney,
Yes.
both right and left ureter,
Yes.
vena cava inferior,
Yes.
yes. The abdominal aorta, yes. Retroperitoneal. The gonadal vessel, yes. Okay. And what about, for example, the first part of the duodenum? The tail of the pancreas? No, intraperitoneal. So be careful about this. Or jejunum, these structures are interperitoneal. Now, if you look at to the left and right ureter, both of them are going to be continue of the pelvis, and they are passing anterior to this muscle. What's the name of this muscle? This was major. The position is retroperitoneal. When they are coming down, when they are descending, they are passing posterior to gonadal vessel, posterior, for example, in the right side, posterior to iliopulic branch, posterior to the right pulic branch, in the left side, posterior to the gonadal vessel, posterior to the left pulic artery, yes, they are passing posteriorly. Each ureter is passing through the abdomen, and after that it is going to enter through the pelvis. And in the end, it is going to connect to the posterior surface of the urinary bladder. When you look at inside of the lumen of both ureter, you can find this lumen is very narrow. And in three parts, in three stages, this lumen of the ureter are going to be get narrow. The first one is superiorly, in the area that the ureter is going to connect to the pelvis. It's a narrow part of the ureter. If a stone comes here, it is possible to stop here because of the narrowing of the lumen at the junction of the pelvis and the ureter. If the stone pass through this narrow part, it is possible to come and stop here. It is the second part, the second area inside of the lumen in both ureter that the lumen get narrow. Where is this? It is
The iliac, common iliac artery.
yes, when they are passing and able to common iliac artery, when they are going to pass from the inlet of the pelvis, when they are going to enter to the pelvic cavity, when they are passing through the anterior to the common iliac vessel, when they are going to pass through the inlet of the pelvis, here the lumen again get narrow. But the narrowest part is when the ureter is going to drain inside of the urinary bladder. Here is the narrowest part of the lumen of the both ureter. A stone that passed through the first stenosis or first narrowing part, the second narrowing part, in the third part that it is the smallest, it is the narrowest part of the lumen, is here. It is possible the stone come here and stop here. So please get in your mind, in three levels, the lumen of the both ureter are going to get narrow. Okay? The first one, superior part of the ureter. continue from the pelvis. The second one, when both ureters are going to enter to the pelvic cavity. And the third one, that it is the narrowest part, is a stage, an area that the ureter is passing through the wall of the urinary bladder. If you imagine, here we have the urinary bladder. This wall of the urinary bladder is a little thick. So now imagine that the ureter is going to enter. It is passing such as this. So here the lumen is very narrow. Okay? Because it is passing through the wall and then it is going to enter here, such as this. So here is the narrowest part. Now, about the ureter, you can look at with this picture that when the ureter is coming down, superior it is going to be supplied by some of the branch that arise from the renal artery. In the middle part, some branch get from the gonadal artery, from the abdominal artery, from the common iliac artery. In this picture, we have a good slide. Remember you that the both ureter are going to be supplied by which of the artery. So